Illuminating the Shadows, a deep dive into a rare and mysterious keratitis by Bharat Gurnani. Decoding Pythium insidiosum keratitis, a rare ocular challenge? This film provides an in-depth exploration of a rare, vision-endangering type of keratitis known as Pythium insidiosum keratitis. Pythium insidiosum is an oomycete which causes a rare vision-threatening keratitis in humans. Pythium keratitis closely resembles fungal keratitis and is also known as parafungus. This disease presents a significant clinical, morphological and microbiological diagnostic challenge. This diagnostic enigma has long puzzled medical researchers and clinicians. This disease has been predominantly reported in tropical and subtropical regions, including Thailand, the United States, China, Israel, Australia, and India. The first case of systemic pythiosis in a human was reported in Thailand in 1985. However, the first case of Pythium keratitis was reported in 1988, and since then, large-scale studies from all over the globe. It affects all age groups, with a higher incidence in certain professions. Studies quoting the incidence and prevalence of Pythium keratitis are scarce in literature due to the rarity of the organism. It is important to understand the hallmark clinical features of Pythium insidiosum keratitis to distinguish it from other close mimickers. The typical clinical features that distinguish it from fungal keratitis are patchy reticular dot-like subepithelial and stromal infiltrate, multifocal infiltrates, cotton wool-like stromal infiltrate with hyphated edges, peripheral furrowing, early limbal spread, and peripheral corneal thinning with guttering and tentacular projections. In recent years, there's been a notable increase in Pythium keratitis cases, thanks to heightened clinical awareness, better diagnostic tools, and more research into treating this severe condition. Its symptoms often resemble those of other types of keratitis, making diagnosis challenging. However, its resemblance to fungal, mycobacterial, acanthamoeba and bacterial keratitis complicates diagnosis. These similarities in clinical features demand a high level of suspicion and careful differential diagnosis to identify and treat Pythium keratitis effectively. Systemic associations. This condition is associated with various systemic diseases, including paroxysmal nocturnal hemoglobinuria and aplastic anemia, among others, further complicating the clinical picture. Laboratory investigations play a key role in early diagnosis and targeted treatment of Pythium keratitis. Corneal scraping is done under topical anesthesia using a Kimura spatula or a Bard Parker blade. The samples undergo gram stain and potassium hydroxide wet mount tests, followed by culture on sheep blood agar and potato dextrose agar. The growth characteristics of Pythium species are observed under specific incubation conditions. Histopathological stains such as hematoxylin and eosin, periodic acid Schiff, and gomory-methenamine silver are used on formalin-fixed, paraffin-embedded samples to identify Pythium filaments. Various staining durations and reactions are employed to confirm the presence of Pythium. Molecular diagnostics such as polymerase chain reaction, PCR, targeting specific regions in Pythium's ribosomal RNA is used for species identification. Different genes and regions are targeted for phylogenetic studies. Duplex PCR and DNA sequencing methods have also been developed for more efficient diagnosis. Serological tests include Western blot, enzyme-linked immunodiffusion assay, immunodiffusion, and hemagglutination assay. Serological tests detect antibodies against Pythium in serum, with varying degrees of sensitivity and specificity. Each method plays a crucial role in identifying this elusive organism. Treatment strategies for pythiosis. Antifungals. Initially, drugs like natamycin, voriconazole, and itraconazole were used, but they have limited success. They are started before culture results and switched to targeted treatments once results are available. Antibacterials. For confirmed cases, a regimen of topical linezolid and azithromycin, along with oral azithromycin, is recommended. Treatment success is monitored through regular follow-ups and clinical signs of improvement. But often surgical intervention like therapeutic and tectonic keratoplasty are mandated for severe non-resolving cases. adjunctive treatments. Techniques like cryotherapy with ethanol and the use of cyanoacrylate glue with bandage contact lenses are employed for better outcomes and to prevent recurrence. Post-operative management is critical for recovery and good outcomes in these cases. This includes continued use of antibiotics, adjuvant drugs to manage symptoms, and careful monitoring for complications like cataracts and glaucoma. Graft survival is a significant concern, and regrafting might be necessary for visual rehabilitation. Patients should be counseled about the disease prognosis and future follow-ups. Pythium insidiosum keratitis can be mistaken for fungal keratitis due to similar clinical, microbiological, and histopathological features, especially in cases that do not respond to typical treatments. The other close mimickers are bacterial keratitis, acanthamoeba keratitis, peripheral ulcerative keratitis, and atypical mycobacterial keratitis. Differential diagnosis is key, as Pythium keratitis can mimic other forms, leading to mismanagement. Early detection and correct identification are vital for effective treatment. Complications are usually vision-threatening and include secondary glaucoma, corneal perforation, corneal melt, retinal detachment, choroidal detachment, recurrence of infection, and phthisis bulbi. Systemic complications such as cavernous sinus thrombosis, systemic vasculitis, paroxysmal nocturnal hemoglobinuria, and aplastic anemia are severe and can even lead to death. Our novel diagnostic and treatment algorithm aims to improve outcomes through dynamic and targeted approaches. This is the diagnostic and management algorithm proposed by Gurnani et al. Thus, to conclude, as we decode the mysteries of Pythium insidiosum keratitis, we open new pathways to preserving vision and improving lives. Understanding Pythium insidiosum keratitis is critical as a step towards better ocular health.